Fantastic. Thanks very much, Matt. I will rely on you to let me know if I can't be heard in the room. Great. I think I can see it there in the background behind you. So I think we're all ready to go. Yeah.
Yeah, and we can hear you as well.
Fantastic. Thanks a lot. So thank you very much for the invitation. A special thanks to Maria, to Matt, and to Amber, and particularly to Kat Baramian, who put us in contact together. So my name is Emma Dorris. I'm based in Dublin in Ireland. I'm part of a national network in what we call public and patient involvement in research, called the PPI Ignite Network. So I'm going to give you a quick overview of the approach that we've taken on a national level to public and patient involvement in Ireland. And this is specifically related to research. So just to give an example of some of the differences, I mean, Ireland is 1/9 the size of Alberta. So we're about 140th the size of Canada, about 1/9 of Alberta. But actually, in terms of our population, it's quite similar. So we have a population about 5 million, which is quite similar to the population of Alberta. And similarly, our main cities are quite similar sized. Where we do deviate quite a lot is with regards to the diversity in our population. Ireland is not a very ethnically diverse population. We have about 92% white in our population, and I suppose the Irish traveller, which is a protected ethnic minority here in Ireland, is only about 0.7% of the population. So when we're dealing with public and patient involvement, actually one of the biggest issues that Ireland has is around the diversity of people that we involve in our research and in this area. Whereas in, for example, our geographical population, we are far more rural in the population in Ireland than you would be in Alberta. However, when you're only ever 2 to 3 hours away from an urban centre, it's probably a bit easier to be rural, huh? So the reason I'm kind of putting that here is that we have some similarities, but we also have a number of differences. And I think there's great learning that can be had across between somewhere the likes of Ireland and Alberta. So public and patient involvement in Ireland is the term that we use here. And I'm going to just define what I mean by public and patient involvement straight up, because I think there is a lot of different terms that are used when we speak about this area. And at the end of the day, the words that we call it isn't as important as what we actually mean. So when we're talking about public and patient involvement, what we mean is taking a collaborative approach, working with the people that the research affects. So the people that the research affects could be patients, people with a lived experience of the condition. It could also be family members, it could be carers, it could be healthcare professionals, it could be social work professionals. It is the people who are impacted or potentially impacted by the research. And when we apply this to the health and social care discipline in Ireland, we call it public and patient involvement. So that's what we mean. I think it's typically patient engagement is the term that you tend to use in Canada. So fundamentally, when we talk about PPI, what we mean is acknowledging that there are different types of knowledge, that there is scholarly knowledge, there's clinical knowledge, there's technical knowledge, but there's also a knowledge that comes from experience, from experiencing something, and that all these are very valid and important forms of knowledge, and that by working together, we can have a much better collaborative research environment. And if we all work together and all respect and value those different types of knowledge, then we will fundamentally improve research, and more importantly, in many ways, improve the impact of research. So what difference the research actually makes, and particularly what difference it actually makes to society and to the people who, for example, patients who are living with particular conditions. PPI in Ireland and research has been hugely driven by one particular funder. It's called the Health Research Board. It was one of the key funders of research in Ireland. And what they did was in 2014, they added one question to all of their grant applications. And that was, how have you involved patients in developing this grant application? They added that one question and I don't know if you have the term throw the cat amongst the pigeons, but it made everybody suddenly sit up and go, oh God, we were supposed to do that. It really caused a big change and caused people to suddenly think very, very differently. This wasn't a scored question. They started by simply asking the question. They then started giving feedback just to the researcher in 2017. So it still wasn't a scored question, but what it did was show researchers how they could improve in this area. It's now at the stage where the feedback does go to panel and it can be the decision between whether a grant gets funded or not. But this simple addition of this one key question back in 2014 was the start of really changing the culture for public and patient involvement right across Ireland. As they did that, the Health Research Board also helped to build the infrastructure by having particular grants that they awarded in 2016. I think the grant started in 2017, specifically to look at how the culture needed to change in order to facilitate proper public and patient involvement. So real meaningful collaboration. They gave 5 awards at that stage, which were just 3 years long, of which we at University College Dublin were one of them. These were very much research grants, still kind of looking to investigate the research ecosystem. And while they made a lot of advancements and got a lot of knowledge out of it, what we really identified that fundamentally there needed to be a systems change in research to enable public and patient involvement to really become the norm, as opposed to some just siloed examples. And that had to be as part of a wider academic sea change and as part of the wider changes that we had being brought down, particularly through the European infrastructure in open science and what in Europe was termed responsible research and innovation. So on the back of this, they funded a second round, and the second round of PPI Ignite is what's known as the PPI Ignite Network. And this was quite different from the first round in that it funded not individual grants to different universities, a single grant that went to a network of places. So what the network was, we have 7 of the main universities right across the island of Ireland. Each of those universities that are in the core group of that also had to put in money into, they funded half of this grant as well. And that's really important to get buy-in from the institutions as well to help support public and patient involvement. We also have 10 national partners, which is a mixture of people from Northern Ireland, but also other research performing organisations and aspects such as our Health Service Executive Research and Development and our Health Research Charities Ireland, which is an umbrella organisation for the charity sector as well, amongst a number of others. We also have about 60 different local partners involved in the national network. And for example, UCD, we have 9 local partners. 7 of those are charity organisations, and they help guide all the work that we do. So this is an example of just our local partners. It's a complete mix of the health and social care aspects. So we have people from Family Carers, Dublin Simon Community, which is a homeless charity, the Transgender Equality Network, and people like the Disability Federation of Ireland. So we have a number of different sectors and voices influencing that work that we do. And that's really important because we are a university and we are very much and very aware that we have a particular way of thinking and processing certain aspects. We need to understand the context within which we are researching better in order to be able to change the practices to make our research more accessible and more collaborative. So that's kind of a very big whistle-top tour of how in Ireland we've taken a national approach to try and change the landscape. And the way we're doing this, we have 5 particular work packages that we as a network work on a national level. Each site also has local work packages that they do, but I'm not going to go into that now. So I'm just going to give you a brief example of some of the work that happens in the different work packages that we have. So the work packages include building capacity across communities. So this would be identifying areas where there may be needed to have a dedicated resources developed to make PPI work better in those particular areas. An example would be laboratory-based research, where it's harder to get public involvement embedded into that type of research because it is not a naturally public-facing research. Others would be around how do we actually embed it into our curriculum to make it that normalized research practice. We also look at institutions. So how are the institutions actually, are they just supporting activities, or are they actually supporting change? So are there policies and procedures that are embedded in institutions that will underline the change required for prolonged collaboration with members of the public in research? Also, how do we know that we're doing it right, and how do we measure that and evaluate it? And then how do we build it up on a national level? So an example here from work package says work stream 2, it's work stream 1, was there was an identification that we had a particular gap in around laboratory-based research. So this would be research that would be, for example, along what's called the translational spectrum. So this is people who might be looking in disease-specific areas and dealing with patient samples, but not necessarily dealing with patients. So what we looked at, what was missing, what was required, both from the people who might take a course like this, or a PhD, somebody who was doing a PhD, how we could support them to actually embed PPI throughout it. And this formed the recommendations for a 5-credit level postgraduate module, but also for members of the public or people with lived experience who might want to actually get, who might actually want to become involved in this. How can they build up their confidence to work in an area that is less obviously tangible to them? And that was co-designed with both of those targeted audiences as well. When we're looking at embedding PPI into scholarship and postgraduate undergraduate education, so we looked at how we could align it with learning outcomes that would be standard for Irish universities. There's also a module on, again, it's at a PhD level, on an introduction to PPI that will be rolled out in a number of institutions in Ireland this year. So this work package 3 is around the institutional policies and procedures. So the first thing we had to do was look at what our current state is. So what were the policies, procedures that were in place at a baseline that we have in Ireland? And what so we developed an instrument to measure and assess this. We had 8 universities or research performing universities across Ireland that took part in this. So we were able to identify at what stage different universities were. This meant that we could then share that knowledge piece around certain universities who had managed to get policies, procedures, changes in place, be it in strategy or at school level or at full university level. How did they progress that, and how can we mimic that across some of our other universities? So we're capturing that change. And then we have more discrete pieces of information. For example, research ethics committee was a big area. So how do we actually look at research ethics committees? How do we look at what the operational issues are around having lay members of the public embedded within it? It's done in some areas, and it's certainly done at our national research ethics committee level, but how do we do it so that it is more embedded across all the individual institutional ethics committees? Looking at building on the promoting PPI excellence, there's always a rush to what does good public and patient involvement look like? How do we measure that we know we're doing it? How do we know we're doing it well? So we needed a framework to build upon that. So we started by developing values and actions. This was led by our colleagues in Trinity College Dublin, their PPI Ignite office. So once we have identified what our values and principles are, how can we then put that into a framework so we can use it to actually evaluate how PPI is looking in research in Ireland. And then finally, we had one around building a strong national PPI network. So through this is how do we build the culture piece so that it is, again, that normalized practice. So we have aspects such as one of our key partners, the HRCI, Health Research Charities Ireland. The national office worked very closely with them for detailing our guide to partnering. So how do charities and research organisations effectively partner for social benefit? What are the things that need to be considered in order to do it in a way that is meaningful to both the charity and the research performing organisation? Because their needs, their expectations and their level of capacity to do that partnering varies greatly. We also have things like, for example, simply a notice board where people who are interested in finding people that PPI contributors or research partners can actually have a single place where they can put, for example, little advertisements from either side so that people can actually connect in the first place. So that was a whistle-stop tour. It's an intro. In many ways, Ireland was slightly later starting in the journey for public and patient involvement than some of our colleagues, particularly if we look over to the UK. But in many ways, we've been able to learn a lot from what's been done in other places and adapt that to take the approach. I would say we're not quite in the infancy in public and patient involvement in Ireland. We might be in our teenage years. And it is rapidly expanding. But what we now have the issue with is making sure that it's not just an expanse for the sake of expanse, it's an expanse for the sake of benefit to society, which is fundamentally what we want to do. So that's what a lot of our focus is on, particularly at a national level, is around quality, around sustainability, and around future proofing, and making sure that when we talk about whether it's patient engagement or public and patient involvement, we're talking about it for the benefit not just of research and the researchers, but also for the public and patient involvement contributors and society as a whole. And we need to have a much more wider focus on that. And that's a harder thing to do than to just look at research metrics, but that's something that we're very much keen on looking at going forward. So yeah, I think I kept to time. So thank you all very much. I might stop sharing and I think I have time for a couple of questions.
Yeah, so if there are any questions from our virtual attendees, please feel free to add them into the chat and Emma can respond to those as she sees fit. Do we have any questions from the people in the room?
Thank you so much, Dr. Dorris. My name is Christina McGuire, and I'm a PPI researcher here. And I was just wondering, I think the idea for the network being embedded at such a broad level is tremendous, but I'm wondering what sort of obstacles or, adverse reactions, perhaps maybe that you have experienced while you were trying to get this together. As you said, you're in your teenage years. I'm sure pre-adolescence wasn't as easy as you think.
Yeah, there's a couple of, so there's always difficulties in trying to do anything that requires change and requires behavioral change. I always find that one of the issues is a lot of the times, particularly the stage we're at now with public and patient involvement, is that we're building value cases. And often when you're trying to get changes in institutions, what you usually build is a business case. And they're different things because a lot of the time impact takes longer to come. And a lot of the evidence around public and patient involvement is less tangible. I mean, it's assumed and we know that there is benefit from it, but it's less easy to capture than, let's say, numbers. So that's always one issue. And you have to really have a good rationale around that. And for some people, you have to change the concept or how you speak about it. So for example, In some areas, research is incredibly competitive. And when you talk about public and patient involvement, sometimes it can be considered, yes, just another thing that researchers have to do. And when they are already have to do, you know, a million other things. And this, you need to actively work to understand the particular discipline or the particular people that you're dealing with so that you can frame it in a way that is of value to them. And that is not going to be the same if you are talking to, let's say, people in the School of Social Workers in that area of research versus people who are in, say, drug design research. So you have to kind of be able to have a broad understanding of that aspect. And similarly, it's not the same if you're talking to people in university management because they make institutional level ones. So there is a lot of needing to really be able to understand your stakeholders and their needs to be able to make cases for them. And I think that's actually one of the biggest issues, is because public and patient involvement isn't one thing. It's not a methodology. It's a practice. It's an approach. And it's fundamentally about maximizing impact. And yeah, so that would be my answer. In a lot of the ways, the hardest part is around the framing and understanding the framing. That makes sense.
Thanks, Emma. There are some other questions in the chat, and I noticed that Esha had her hand up to speak as well. But in the interest of time, we're going to move on to Dr. Bjorkman's presentation. So if we could get thank yous, round of applause for Dr. Dorris, that would be great.